Welcome, everybody. I know these are very difficult times, and what I think is so important for us as a community is to work together, to stick together, to share the sense of responsibility and the sense of perspective together. And so with that in mind, what I've decided to do is to share with the community a weekly update. And I've brought together our panel of experts, and what we're going to be doing each week over the course of the next few weeks as we get through this third wave together as a community and as a country, to bring our experts together to share their perspectives, to help us understand what is happening, where we are holding in the third wave, what we can do, both from a medical point of view, but also from a community and a spiritual point of view. So first up, we have Dr. Richard Friedland, CEO of Netcare, to share with us the perspective of the numbers and where we're holding at the moment. Thank you, Dr. Friedland, for taking time. I know that you're under tremendous pressure, and we are so grateful to you for making the time to join us today.
Good evening, Chief Rabbi and colleagues, and thank you very, very much. Since we last presented an update just over 2 weeks ago, the current position in the country has changed dramatically, with a very significant increase and surge in COVID-19 cases. Added to that, the announcement this weekend of the presence of a new variant, the Delta variant or Indian variant in South Africa, is extremely alarming. And I will give way to Professor Schoub as our expert to explain the implication of that. The most important aspect of the new Delta variant is the fact that it is far more transmissible than the current variants we have been exposed to in South Africa, and increases the present danger and risk for all of us. It's currently in about 85 countries across the world. It caused the scourge in the Indian subcontinent. It's now present in the United Kingdom and causing that increase in Russia. And now it's been detected in 5 provinces here in South Africa. I'm going to be showing you the numbers as they have panned out, but knowing that it is far more transmissible, the key message that we need to take home is that if we were expected to be vigilant in the first and second wave in terms of hand hygiene, social distancing, and the wearing of masks, how much more so do we need to be with the advent or presence of this variant? It's against this background that we also welcome the announcement on Sunday by our president of the adjusted level 4 lockdown measures. These are critical in our coastal provinces in flattening the curve, and we think they are timeless. Unfortunately, we are peaking here in the Gauteng, and that may come too late to flatten the curve. It'll certainly prevent more hospitalizations and deaths. So we welcome that. And I think the advice that we gave just over 2 weeks ago to really hunker down here in the Gauteng in terms of our own community was the right advice. And as we'll probably hear from Lance later, we're beginning to see a plateauing of those numbers within the community here in Johannesburg. Unfortunately, the numbers in Cape Town and Durban are showing steep rises. So let's get on to looking at the numbers quickly. I think if you can have a look here, you can see over the past 7 days, a massive rise of 105,000 new cases in South Africa, the vast majority, well over 60%, occurring in the Gauteng. But now we are seeing rises in the Western Cape, Eastern Cape, and KwaZulu-Natal. And if you look across to the right, you can see very significant increases across the major provinces. And as we mentioned some 2 weeks ago, the Free State and the Northern Cape have plateaued and are declining. They are not coming off as fast as we thought they would. This may have something to do with the presence of this Delta variant, but nonetheless, positive signs there. This is a very important graphic to show you the three waves superimposed upon each other. The gray wave representing our first wave in South Africa last year, the blue wave, the wave we saw over the December-January period, and in orange, the new third wave. And you can see that this has rapidly surpassed that of the first wave in terms of numbers. And our predictions are that we will surpass the numbers in the second wave towards the end of this week in South Africa. Again, looking at the positivity rate in our country, that's the number of people that are testing positive on a daily basis. It shot up to 26.9% on Sunday. If you look at tonight's numbers that have just come out, it is well over 28%. And that is very, very significant in terms of more than 1 in 4 South Africans currently impacted by the virus. Again, testing, we are testing ahead of the virus, and that's a positive. That means we can identify positive cases and ensure that people self-isolate. If we look at it on a provincial basis, and this is data that comes out of the NICD every Friday. Unfortunately, the data that comes out is a week old, but have a look at the Gauteng. You can see the week-on-week increases at 32.1% was the data that came out on Friday, but represents the position a week ago. And the Gauteng Department of Health released data last week suggesting this number was at 37%. Therefore, more than 1 in 3 people in the Gauteng is currently testing positive for COVID. If we look at KwaZulu-Natal, it's gone up to 8.2%, again, a lag of a week, and we suspect that's well over 10% by now. In the Eastern Cape, we suspect that's closer to 15%. And in the Western Cape, where we're seeing a surge of cases, and they are in an official third wave, we suspect that is well over 20% at the moment. Let's just have a look at the Gauteng, because when I last showed you these cases, we were steadily rising, and we are continuing to rise. We're suspecting that this week we may hopefully and mercifully peak towards the end of this week, but a massive increase in cases from May. And it's really this graph here that was the result of us issuing the advisory or recommendation to our community in order to lock down in terms of closing schools and functions and religious activities. Because as you can see, where we were when we presented last, we were at this level over here. The guidance given by experts right across South Africa was that our wave would be lower but longer, and it would last something like that. But unfortunately, 2 weeks ago, literally on the 15th or 14th, 15th of June, that trajectory broke the trend line and shot out. And it was as a result of that that we issued our cautionary and advisory to the community. I think that in hindsight has turned out to be correct, because you can see the almost vertical increase in this third wave. We suspect, even though the sampling is not yet available from CRISP, that this is due to the Delta variant. It's interesting to note that until this Delta variant, we were only dealing with the Beta variant that we saw in the second wave. It's less than 6 months away from us. And this variant was only classified by the World Health Organization as a variant of concern, not just interest, on the 11th of May. And it just shows you how rapidly it has spread across the world and impacted us here in the Gauteng. And as a result of this, placed enormous pressure on bed capacity, particularly critical care bed capacity in the Gauteng. Looking now at the Western Cape, you can see the significant increase over the last 4 weeks. And if you just have to take a trajectory across as to where we are today versus where we were in the second wave, is approximately here in the first and second week of December. And as I said to the Cape Town community, if we knew what we knew now on the second week of December, we would surely have put in place far more stringent measures to prevent the devastating peak and surge of cases. And so I do think that government's adjusted level 4 measures will help us flatten this curve in the Western Cape. And again, if you look at the Western Cape, comparing the different waves, this is the first wave in gray. You can see that where we are in the Western Cape is we're about to surpass the first wave, but hopefully with the measures put in place and the additional vigilance of everyone, we are going to see a flattening of this curve and avoiding the huge loss of life and hospitalization we saw in the second wave. Moving now on to the Eastern Cape, you can see the case numbers are not as high as the Western Cape, that is officially in a third wave, but certainly out of recovery and certainly a time of concern. I can tell you, just from a hospitalization perspective, in the Eastern Cape, we have ceased all elective surgery today, given the number of COVID positive cases we are seeing within our 2 facilities down there. And again, if you look now quickly at the average number of cases in KwaZulu-Natal, you can see, again, rising very steeply. Again, not 30% of the cases of the second wave, so not officially in a third wave, but we are concerned with holidaymakers coming down from the Gauteng, may have the same super spreader type of scenario that we saw with the matric rages in Belito, and we are remaining absolutely hypervigilant given the prevalence in over 70% of samples taken in KwaZulu-Natal of the Delta variant. And then quickly looking, as I always do, at the transmission of the virus, we measure this in terms of the reproduction number, and if it's above 1, we are in a full-blown pandemic, and if it's below 1, we are in a recovery phase. You can see the pattern in the first wave, second wave, and third wave is almost identical. The RT number rises above 1 for several weeks here, between 11 and 13 weeks. And then as we begin to peak, it begins to fall precipitously. Same pattern in the first and second wave. And this is what we are probably going to see in the third wave, but we have no sign yet that this RT number is reducing anytime soon. I'm going to stop sharing there and just give the final message. There is a huge amount of focus on the number of hospital beds that we have throughout the country, the number of ventilators, clinicians, and oxygen. But the reality is, and this is akin to motor vehicle accidents, no amount of hospital beds, no amount of clinicians, no amount of oxygen are going to prevent motor vehicle accidents. They are only prevented by people driving safely and with caution. And likewise with COVID-19. This pandemic will be determined and prevented, obviously in the absence of a vaccine, certainly by the behavior of each and every one of us. And so I cannot urge us more strongly, now more than ever, to take absolute precaution given the presence of a highly contagious Delta variant. Thank you very much.
Thank you so much, Dr. Friedland. Thank you for your time and the perspective that you always provide, and for everything that you are doing for our country during these very trying and difficult times. Professor Schoub, I think it will help us a lot if you could illuminate this the Delta variant and what it means, and just to understand it in context of the previous variants, both from an academic point of view, but also then from a practical point of view in people's everyday lives. Professor Schoub, thank you so much for your time today.
Yes, good evening, Chief Rabbi. Thank you very much for inviting me to give this talk. Dr. Friedland has kind of illustrated very graphically the impact of this variant and what it has done to the prevalence of the infection and the severity of the infection, and also the very sudden, steep increase in the number of cases. So what I want to do is give a little bit of a background an overview of what is this Delta variant, where has it come from, why is it causing such havoc? So let me take one step back. These viruses do change very rapidly. In other words, they mutate, they change their characteristics, and they produce many variants. However, there are 4 variants which are classified as what we call variants of concern. These are international classifications from the World Health Organization, the CDC, and so on. The alpha variant is the variant which was dominant, which was, I'm saying past tense, dominant in Europe, in the United Kingdom, in Israel, in North America, and that's now been replaced by the Delta. The beta variant is the one which we had, and was dominant until fairly recently, and that drove the second wave. The gamma variant is the one found in South America. It doesn't seem to have spread very much outside Brazil and neighboring countries. And now we have the Delta variant. The Delta variant was originally detected in India. Unfortunately, it was often also called the Indian variant, but we don't like giving them the geographical names. Delta variant is the one which is by Richard known. This was first detected in March of this year, and in South Africa was introduced into this country, or was detected first in this country, the end of May, and was brought into the country by travelers. And we thought until very recently, when I say very recently, the last couple of weeks, that it really would be contained. So we are all, as scientists as well, taken aback by the fitness of this virus, the strength in which it has spread so rapidly in the country. So it's obviously dominant in Gauteng, but it is found in 4 other provinces and increasing very rapidly, and has probably spread already throughout the country. Now, this virus, like all the other variants, has got certain mutations which give it certain characteristics. And in fact, each of these variants has got some bad characteristic. All of them are more transmissible than the original strain which came from China, the so-called Wuhan strain. Wuhan was the city where it was first isolated. And all of them have some kind of bad trait, bad characteristic. The alpha variant in the developed world, the Northern Hemisphere, that was not only was more transmissible, but probably also was more virulent, in other words, causing more severe disease. The beta variant that dominated until recently in this country, that's its bad trait, not only being more transmissible, but it was more resistant to vaccines. It made it very much harder to get immunity as a result of vaccination, and in fact limited our choices of vaccines to only 2 vaccines, which were really shown to be effective against the beta variant, the Pfizer and the Johnson & Johnson. The gamma variant, also more virulent probably than the original strains, and now we have the Delta variant. The Delta variant, its characteristic, as Dr. Friedland mentioned just now, is its hyper-transmissibility. Very, very contagious. You spoke about reproductive numbers. The basic reproductive number, in other words, there's no interference of the previous strains, was of the vicinity of about 2 to 3. This is about 6 to 8. So it's really an extremely transmissible virus. It doesn't take much for transmission to occur from one person to another person. In fact, it's been calculated that it's anything from 50 to 60% more transmissible than our beta variant. And if you compare it to the original strains, it's at least double as transmissible. So in other words, you don't need very much of that virus to go from one person to another person to establish infection. And that has got a lot of practical implications, because all the preventive measures, the cautionary measures that we gave for the previous, the beta, now really needs to be changed. You know, we said that if you come into contact with a patient with an individual that's infected for less than 15 minutes or more than 15 minutes and less than 6 feet away, etc., those will probably have to change, because now very much more casual encounters between people will probably establish infection. And not only that, we know that this virus will survive in these tiny little droplets, these what you call aerosols, which remain suspended in the air for a reasonable amount of time, probably 6 to 8 hours. So all of this is very difficult, very challenging in terms of how cautious we need to be to prevent infection being transmitted from one person to another person. So as vigilant as we had to be in the past, we really now need to be far more vigilant. That's I think the kind of take-home message of the variant story. In terms of its clinical, it is a virus. A coronavirus behaves like all the other coronaviruses. However, it does seem to have a little bit slightly different clinical presentation. There's more of the headache, the sore throat, the runny nose, sneezing, that kind of thing, and less of the loss of taste, loss of smell, less of the temperature. It may be because this virus seems to be affecting young people more, and it may be that is why you're getting a slightly different clinical presentation. And the reason why it's affecting young people more is probably because it is so much more transmissible. It's penetrating more into the population. Of course, the big question, and we don't know the answer as yet, is does it cause more severe disease? That is still being studied. At the moment, there's no data. The moment to answer that question, it does so far appear to be not more virulent than the beta, but the jury is still out on that. We still need to kind of wait and see what is found. Certainly, the age distribution is different, seems to affect younger people more frequently. And then, of course, the big question which everybody asks is, how will the vaccines perform? And, you know, we've got our Pfizer vaccine and we've got our Johnson & Johnson vaccine, and both of them, in fact, perform very well. In fact, much better than the beta variant. For example, preventing symptomatic disease, in other words, infection which causes any illness, after one dose of Pfizer, there's only 33%, but after 2 doses, there's 88% protection against any clinical illness. But obviously what we're mainly interested in, you want to prevent people going into hospital, people getting severely ill, and obviously you want to prevent mortality. And there, the Pfizer performs exceptionally well in trials which we've done in the United Kingdom. After a single dose, it's 94% effective preventing hospitalization. And after 2 doses, a little bit better, 95%. So it is very effective, and that's good news. We don't yet have the data for the Johnson & Johnson, but certainly from laboratory data, from other studies, we are pretty sure that it will perform almost as well, if not as well, as the Pfizer. And in fact, even lesser effective vaccines like AstraZeneca also perform reasonably well, not quite as good as the Pfizer or the Johnson & Johnson, but also reasonably well, again, studies from the United Kingdom. So just to sum up, the kind of difficulty is the excessively high transmissible rate of this virus, which demands very much more vigilance, very much more caution in protecting oneself. There's a little bit of a slightly good news in that vaccines seem to be more effective, in fact, than the beta strain. So that's just a brief overview of the Delta variant.
Professor Schoub, thank you so much for the presentation and for the perspective and the understanding. And you know, if there's some sort of light at the end of the tunnel, it's what you mentioned at the end, that the vaccinations, you know, the Pfizer and the Johnson & Johnson do provide a good protection. So please God, you know, that will come soon. You know, thank you so much for your presentation and your work, also in your chairmanship of the Ministerial Advisory Committee and everything you do for the community. Thank you so much for your time today as well.
Thank you. Thank you.
Sure. And now we're going to ask Lance Abramson from Hatzolah, chairman of Hatzolah, to give a perspective from a community point of view of the numbers in the community. And we're going to ask Lance to talk both to the situation in Johannesburg as well as in KZN on behalf of CSO Medical in KZN. And Lance, just want to thank you and everyone in Hatzolah for the incredible work that you're doing, literally carrying our community through this. And if you'll give us a perspective now of the numbers in the community, how are we looking at the moment?
Thanks, Rabbi. I'm just going to share my screen. Can you see that?
Yes.
Great, thank you. So this is feedback from, firstly, I'm just going to do the, see, there we go. So this is the Durban community figures that they've asked me to present. It's actually the South African Jewish Board of Deputies who are ably running the program down in Durban. And for the month of June so far, they've had a total of 53 new cases for the month of June. Of those cases, 5 were hospitalized, and of another 7 were treated on home oxygen. So that's for the month of June so far down in Durban. And for this week, the new cases are 21 new cases for the week, which brings them to a total of 22 active cases, 3 hospitalizations this week, and 2 cases on home oxygen this week. So the numbers still kind of relatively low and building up though, because they've had 53 for the whole month of June and 21 in the last week. So you can see that there is that increase happening down there, and you know, the numbers climbing, but still not nearly as high as the numbers as we're going to see now for the Johannesburg community, which is also obviously a very much bigger community. So for Johannesburg, unfortunately, last week, we had 568 new patients onto the program in 1 week. And that actually represented the highest number of new patients in 1 week for all 3 waves so far. So that's quite a high number of new infections that we saw. To put that in perspective, this is going back about 10 weeks. And if we look at this over here, so I mean, that's kind of when, you know, the virus was very low and there wasn't much infection. We were only looking at 12 new cases for a week. It went up to 25, 44, 68, and then it started to grow into bigger numbers, 107, 131, 181, 276, and then this big jump here to 532 new cases in 1 week. That was 2 weeks ago. I think if there is any silver lining, Richard alluded to it, we are hoping and praying that this difference over here is not as big a difference as we've seen in previous weeks. And we're hoping that this is going to represent some sort of plateau that we've now reached, with the community having locked down and extra measures coming into place. We're hoping that we're now going to start seeing the benefit of that, and we'll have some sort of plateau, and then we'll start to hopefully see that drop off. So this week is going to be a very interesting week that we're currently in. There are still a lot of infections daily. I know that those numbers are not in here yet, but it's of this kind of ilk, and we're hoping that really we're at the top, and we're hoping we're going to see another week at, you know, not higher than this 500s, and then we're hoping that it's going to go down after that, and we're going to see the benefit of the community locking down. This is the active cases per day over here. So this was the top of the first wave, 263, top of the second wave, 333. And at the end of last week, we were looking after 862 active cases. So there were 862 active patients on the program. That's a big number of patients to look after, and a big shout out to the team for all of the work that they're doing in looking after those patients. We currently have 48 patients on the program in hospital. We monitor them when they go into hospital, and we usually continue monitoring them when they come out of hospital, just to make sure that they fully recover and don't relapse. And we are currently looking after 101 patients on home oxygen at the moment. That's obviously a very high number of patients. And the aim there again is to keep those patients out of a very heavily saturated hospital system. So if we can keep them home and on oxygen and being visited by nurses, that is a great benefit to the hospital system. These are just the numbers, always to share them. The top one is if you test positive for COVID in the Johannesburg area, you want to join the program, you can contact that top number over there. If you need emotional support, that's the second number. And the bottom number is obviously just the usual emergency line. That's to dispatch the ambulances. And then I must always end off with a big thank you to our team, to the wellness team, and particularly the responders and dispatchers. The responders at the moment are having a very difficult time with patients in the back of the ambulance for many hours, in the parking lot of hospitals. Most of our response team is volunteers, and it's really just, I take my hat off to each and every single one of them for the amazing work that they are doing.
Lance, thank you so much for your presentation, and please convey to your entire team on behalf of the whole community how deeply grateful we are. Your team are absolutely heroic and risk their lives and working around the clock, and we are so grateful. What a blessing Hatzolah is to our community, and thank you for your presentation today to give out that perspective.
Thank you.
We're now going to move on to Cape Town. Loren Raize is going to present on the situation in Cape Town. Loren is the head of CSO Medical in Cape Town, and as has been mentioned, that Cape Town is, in terms of the numbers, started off slower, but now things are increasing. And Loren, also, we're very grateful to CSO Medical for the incredible work in Cape Town. Thank you so much. And please share with us the perspective of what's happening in Cape Town.
Thank you so much, Chief Rabbi. I'm also going to just share my screen here. So Cape Town, as has been mentioned, is a little while behind Johannesburg. This is at the moment what our community cases, these are the cases that have been reported to us through 2020 and 2021. So this is what our graph looks like. If you actually have a look at this gradient over here from May to June, you'll see that it almost mirrors exactly an earlier slide that Dr. Friedland showed us in terms of the trajectory of the Western Cape. And I can certainly say that we've seen a steady increase in cases, certainly over the last 4 to 6 weeks. Our current numbers on the wellness monitoring program, we have monitored 975 patients to date. We currently have 72 active cases. There certainly is something to be said for this program, this early intervention program that Hatzolah have developed. As shown by that fatality rate comparison, we are sitting on a 3.1% fatality rate, which is a full 1% lower than the Western Cape fatality rate. And I therefore strongly encourage everybody in our community who does test positive for COVID to register on this program. We've had a lot of people tell us that they don't need to and that, they're doing just fine, but we've seen firsthand just how quickly things can deteriorate and just how valuable that early intervention can actually be. If I draw your attention to this graph over here and the magnified section of active cases per day, you'll see there between the 20th and the 25th, just how steep within 5 days those cases climb. Now, the numbers in Cape Town are still small, and we are very much hoping, as Dr. Friedland said, that government's lockdown interventions are going to help us to flatten the curve here in the Western Cape, so that we don't see the same numbers that we saw in December. But we need our community really to play their part in helping us to do this. We need them to take their lockdown restrictions very seriously and not to look for loopholes as to how to get around these. We all know how difficult it is to not be with our extended family at this time. But what we've seen in our numbers and in the trends is that this new variant seems to be, as Professor Schoub said, it's far more contagious. So we're asking, please, to limit your Shabbos tables to just the family members that are living in your household. We are now on school holidays, so please a careful reconsideration of any travel plans, especially if you are wanting to stay at hotels. The safest place right now for you and your loved ones and to be able to help us to actually flatten that curve is to stay at home. And of course, we want to really encourage eligible members in our community to get vaccinated. The actions that we do take today will save lives tomorrow. So if you have tested positive, please register on the CSO Cape Town wellness monitoring program by visiting our website, csocape.org.za. The process is fairly simple. You just follow an online form to sign up. And apart from that, I must echo a few things. Firstly, I have to take my hat off to Hatzolah and their team. We've heard some horror stories coming out of Gauteng, and we know that you guys are under major pressure. So we're here for you, and thank you for all the work that you are doing. Also, I'd like to thank my own team of volunteers who have worked tirelessly, what feels like almost since December. It's an amazing team to be a part of, and an amazing initiative to be able to help this community through this. So thanks to all of our volunteers and our medics as well that are putting themselves at risk to be able to help our community here in Cape Town. Thank you, Rabbi.
Thank you, Loren, and please convey on behalf of all of us thanks and appreciation to your amazing team of CSO Medical in Cape Town and for the heroic work that they do. Thank you so much for your presentation. I want to thank our whole panel today for participating. And what we're going to be doing now is, after we've heard the medical perspective and understanding what we're going through, both in terms of the trends as well as understanding the variant and the community numbers, and what our responsibilities are from a medical and safety point of view, and also mitzvah point of view. It's a very important mitzvah to look after our health and to preserve life and to save life. Pikuach nefesh is the overriding principle in the halakha. And so we bear that in mind at this time, and we realize that the duties of safe behavior, of social distancing, wearing masks, all of what has been mentioned today is part of our mitzvah as Jews. It's part of what the halakha, what Hashem wants from us. Hashem also wants from us at this time to continue to pray and to daven. We've been going on an 18-day campaign of Tehillim, a Tehillim a day. And what we're going to be doing in these weekly sessions is, after we've had the medical presentations, to say a Tehillim together. So we're going to put the text of the Tehillim, of today's Tehillim, on the screen. I'm going to say the words of the Tehillim, and I would like each of you to pray along with me as we say these words of the Tehillim, and afterwards I'm going to close the session just with a word of Torah, an idea to conclude the session and to give us some strength and direction as we head forward. So we're going to say this Tehillim, and having in mind that it should be in the merit of the refuah shleima, the speedy healing of all of those who are sick within our community, our country, and our world, and at the same time to pray to Hashem to bring a speedy end to the third wave and to this pandemic completely. This is Tehillim chapter 30, in which King David, the author of these words, who authored it with divine prophecy, these are very beautiful words where he talks about calling out to Hashem in times of great distress. The Tehillim is as follows: Mismoshir Chanukah Sabais LeDavid Daromimcha Adonai Ki Delisani Veloi Simach Davali Adonai Elohai Shivati Alecha Vetipareini Adonai Helisa Minashol Nafshi Chisani Miyardivo Zamrula Adonai Chasida Vahodu Lezecher Kocho Ki Rega Beapochai Birtsono Bervialin Bechi Velaboke Rina Ve'ani Amarti B'Shalvi Balemot Leolam Adonai Birtzoncha Himadeta Lehariozi started Panecha Yisaniva Lecho Adonai Ekra Vel Adonai Eschanan Mabetza Bedami Vidati El Shachas Yodcha Farhaigilamite Choshema Adonai Vechoneni Adonai Elzerli Afachta Mispeti Lemacholi Vitachta Saki Vitazeni Simcha Leman Yezamecha Chavod Velo Yidoi Adonai Elohai Leolam Moideka. So please God, our davening, and we should daven each and every single day, should be a merit for refuah shleima for everyone who needs it. And I would, for those who want to join our Tehillim, please email my office to be added onto the list, and we send out a daily Tehillim on WhatsApp and on email so that we can all daven together. And allow me just to conclude with one thought on all of this. With the president's address last night, So he's put a national ban on all gatherings, including religious gatherings, places of worship. And that, of course, means for our shuls. Of course, under the guidance of our medical team of Professor Schoub and Dr. Friedland, we already had recommended the closing of our shuls in Gauteng, and our shuls have already been closed for 2 weeks, even before the president closed places of worship. Now the government regulations extend to the whole country. And so for those in Cape Town and in KZN, Durban, Umhlanga, and in the Eastern Province, shuls are now closed and they've been open until now. For Gauteng, people have now already not had shuls in Minyanim for 2 weeks, and the president has now imposed this for a further 2 weeks. And this is the third time over this period of the pandemic that our shuls have been closed. And it's very difficult to have our shuls closed. And it was under the guidance of our medical team, but it's obviously was a deeply agonizing decision already 2 weeks ago to close the shuls in Gauteng. But of course, as we can see from the data and the numbers and what has happened, it was the required and the mitzvah and the halakha of what we had to do. But I think that what's so important for all of us as a community now is to ensure that we make our homes into our shuls for the next 2 weeks while we cannot attend shul. And that means that we need to ensure that our homes are filled with the holiness and mitzvahs. That means that our davening continues. We daven at home. That means on Shabbos, our Shabbos should have structure, even if we're not at shul on a Friday night. We should all, before supper on Friday night, candles lit, obviously before sunset at candle lighting time, and then to daven Kabbalat Shabbat together as a family. The mitzvah is actually to daven Kabbalat Shabbat even before sunset, to bring Shabbos in a little bit early, and to daven that as a family together, even if you're not at shul, but everyone should come together, bring your siddurim, daven together, daven Ma'ariv before going to the meal, and then have a proper Shabbos meal. And then on Shabbos morning, also the family should daven Shabbos morning together, make kiddush, have a bracha, have maybe someone should prepare a Devar Torah for the table on Friday night, a Devar Torah for the table on Shabbos lunch, to share words of Torah, to bring inspiration. And then on Shabbos afternoon, Mincha and Sudash Lishit, the third meal. So to make sure that Shabbos has a structure, has holiness, has a sense of togetherness as a family, that we rely so often on our shuls to do that for us, to give structure to the day, to give that sense of connection and holiness to the day. We need to create that in our homes. And that is something so important. And it is something that will serve us well for even when we return to our shuls, please God, in 2 weeks' time. We pray that we're able to return as soon as possible. But when we do, then we remind ourselves that when we go to shul, we're not just passive participants, we are active contributors to shul. We are active participants in what happens in our own homes, to build Torah in our own homes and to make our homes holy places. A shul is a holy place, and it's a source of inspiration and togetherness and community. And we need to make sure that our homes are as well. That, please God, when this pandemic is over and we can come back to our shuls in numbers, and certainly, please God, when the shuls reopen, when the situation allows, we can already start to return. But ultimately, when we've all been vaccinated and we're able to return to shul with our full numbers and full strength, then we should do so, and at that time have homes which are filled with inspiration and our shuls which are filled with inspiration. But we can, over these weeks of lockdown, the next 2 weeks, as we go through this difficult time of the third wave, we need to dig deep from an emotional, psychological, spiritual point of view. We need to rely on each other. We need to rely on Hashem, and we need to make our homes places of love and light and inspiration and closeness to Hashem. And that we can do. And that is what we need to do during these times. So we respond from a medical safety point of view, but also from a spiritual point of view and from a Torah point of view as Jews. And that is something which is so important for all of us. So I want to thank our panel who've come together on this Monday evening, the 28th of June. We, please God, will be once a week over the next few weeks, recording this presentation and context for the community as an update for the situation. And please God, may the week ahead be one of refuah, of healing, health and healing and safety for our community, for our country, and for our world. Thank you so much for listening today and being part of it. And let's go forward together as a community, together in unity. Thank you so much.